one.
Okay. Knock, 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 knock. Hi, my name's Bryaunna. I'm going to be your nurse today. I've gathered my supplies. I'm going to perform some hand hygiene. Okay, so I've got my, can I get your name and date of birth?
Michaela Emo, 12/22/95.
Okay, perfect. So you need some fluids, so I'm going to be inserting an IV today.
Okay.
I've got my supplies. I have my saline syringe. I have my 22 gauge catheter with 1 inch needle on it. I've got my lock and then my tourniquet and tape and everything together. So I'm gonna go ahead and since we're doing an insertion of an IV today, I would like to offer any pain measures if you'd like. My first option is called Pain Ease. It is a spray for your hand. It takes about 10 seconds. I'll do it about 3 inches away from your hand. It takes about 10 seconds to enact. Another option is some topical analgesia. My first one is called LMX, and it takes about 30 minutes after we apply it to enact. My other one is called EMLA. It takes about 60 minutes to enact after we apply it. And then I do have some intradermal lidocaine, which is an insertion, so I would insert it into the site on your hand. And then a little bell would come up and then we'd let that take effect. So would you like any pain management today for this?
No, thank you.
Okay, so I'm going to go ahead and prime my saline. Open this up. I'm gonna make sure that the bed is at a comfortable level, which it already is because I'm kind of short. So that's perfect. I'm gonna open this. I'm gonna expel any air from the top. Okay, perfect. I don't see any more bubbles. Okay, I'm gonna set this on here. So that was good. And then I'm going to open my saline lock port here. Okay. And I'm going to connect this and then make sure not to touch any of the other tubing to keep it sterile as it is. So I'm going to connect this together, okay? And then I'm going to prime this.
Would you like any pain? I'm okay. Okay.
Over the garbage, okay, and I don't see any air bubbles, so that is ready to go. Okay, so I'm going to sit this here. Perfect, so it doesn't touch anything else. And then I'm going to open this.
I have my 22 gauge needle 1 inch.
Okay, I'm just going to get this all set up and ready.
And I have my IV start kit.
I'm going to open the back so that is ready for me when I need to grab it. Okay. And I'm going to go ahead and apply a tourniquet just so we can see where the veins are at here. Okay. I'm going to do that about 4 to 6 inches above my insertion site. Okay.
I'm going to go ahead and open this, making sure I don't contaminate it.
I don't want to pinch you. Okay. All right. I'm going to look here. Okay. It looks like I found a good one. I like that one for this. So I'm going to go ahead and I'm going to undo my tourniquet. If I had used any analgesia at this point, I would take an antiseptic towelette and I would wipe that off for any excess. But next I'm going to go ahead and apply gloves.
I'm going to go ahead and just grab my tourniquet. I'm going to place my towel under the
Right. I'm going to go ahead and put a towel underneath my patient. Okay. And I'm going to go ahead and clean that site, my chlorhexidine, for 30 seconds. Okay. And I would clean this for 30 seconds.
I'm going to go ahead and clean my area for 30 seconds up and down and back and forth.
Okay. Okay, so I'm not gonna contaminate the area now. I can throw that away. I'm gonna let it dry completely, and I will know it's dry because it is no longer shiny.
And then that is better looking tough. I'm gonna go ahead and wash my hands, and I'm gonna apply gloves. I know that the area is dry when the skin is not
Okay,
shiny
it's
anymore.
dry. So the next thing I'm gonna go ahead and do is I'm gonna reapply the tourniquet. Once again, 4 to 6 inches above my insertion site.
Let me go ahead and open up my needle.
Okay. So I'm just going to quickly prep one thing here. I'm going to loosen the cap just so I can easily grab that when I need to later. Okay, and I'm going to prepare my catheter needle here.
Open up my cap.
Okay. All right, and I'm going to open the bed, the cap. Okay, so I'm gonna go ahead and turn that 360 degrees. I'm gonna make sure I only touch the very tip of that blue with not touching the sides. I wanna make sure my glove is nice and tight. Okay, and okay, make sure I can pull that off. I'm gonna put it right back on there. Okay. So then I'm gonna grab my patient's hand with my non-dominant hand. I'm gonna pull taut the skin. Okay, and now I've seen my vein, everything is ready to go. So I'm gonna come at my patient's hand almost parallel, just like a 10-degree maybe maximum. Okay, just wanna make sure that is on. Okay, there we are. Okay, so I'm gonna insert it. Okay, and then I'm gonna, so now that I'm in the vein, I'm gonna go ahead and go parallel as I can to the skin, and then I'm gonna insert it until I see flashback or blood return from the patient. Okay, I see flashback, and so now I'm just going to insert it 1/4 of an inch in further. Okay, and now that I've done that, I'm going to push my catheter as far into the insertion site as I can from that blue piece. Okay. Good. So now once I've done that, I can let go of my patient's hand. I'm gonna let go of the tourniquet, and I'm gonna occlude the vein. Okay, and then I'm gonna go ahead and hold that blue piece for there. Okay, and then I'm gonna slowly pull out the needle. I'm gonna back to my safety device. Okay, and now I'm going to attach my tubing. So be careful not to contaminate the top of that. And now I'm going to screw this into my catheter. And I forgot to warn my patient about a prick, but I would have done that before doing so. Okay, and now that that's attached, I can let go from occluding, but I won't let go of the catheter because I don't want it to be released by the weight of the saline. So I'm going to warn my patient. I'm going to go. I'm going to flush this. So let me know if you have any pain or anything weird going on. Okay, I'm gonna slowly push saline, and it's going easily, so I know that there's no issues and I don't see any swelling. Did you have any pain with that?
Nope.
Okay, so then I'm gonna go ahead and I'm gonna grab my window tape so I can put this over my patient. Oops. Without touching the actual tape because I don't want to contaminate my site. I'm going to make sure that my actual site is in the window.
My patient's response to the procedure.
Okay.
The flow rate, the number of
Perfect. Okay, and then I can go ahead and pull this off. And I'm going to put the
initials, and that will conclude the insertion.
Sorry, just having trouble with the grip. There it is. Okay.
I'm gonna say
There is that. So perfect. I can see my insertion site. I'm going to go ahead and put my tape
get my gauze
over.
and I have my tape.
Okay, so now that is much more secure. I'm going to go ahead, and I still don't see any swelling or redness at the site, which is good. You're in any pain at all?
Nope, it feels good.
Good. So now I'm going to go ahead and apply some tape over that piece to stabilize it onto the patient's hand. Okay, and then this, go ahead and it will mark the date and time that the catheter was inserted. Okay. Perfect. And so then next, I would go ahead and disconnect the saline syringe, and then I would use an antiseptic, and I would wipe this, and then I would wipe the end of my tubing, and then I would attach that, and then I would go ahead and set the flow rate for my patient. So next, since there's no swelling, there's no redness, no pain or anything, the site is okay. So now I can take my gloves off and clean my area, put all my sharps into the sharps container. Chink, I can't reach very good. Okay. So this will all get cleaned up. So I would go ahead and document this. I have 7 things I would document. I'm going to document any analgesia that was used. I will document the insertion site, which is on my patient's right hand, the number of attempts that it took to get the IV into there. I would document the patient's response, the size of the catheter, which was my 22 gauge 1-inch needle, the patient's response, the date and time, and then the flow rate that was put into the IV. So next I would check the orders coming back to see that I am supposed to discontinue the IV from the doctor's orders. Okay, I would get my patient's name and date of birth.
Michaela email 12/22/95.
Okay, so we're gonna go ahead. My name's Bryaunna, I'm your nurse still. I'm gonna disconnect the tubing from your hand. So I would perform hand hygiene. I would reapply gloves. I made sure I had all of my supplies with me. I've got my tape and then my 2x2 gauze items. So I'm gonna go ahead and start making sure that the catheter, everything looks good. Are you in any pain at all?
Nope.
Okay, and I don't see any redness or any swelling. So I'm gonna go ahead and I'm gonna start peeling off the tape and the window, and I'm gonna do that in the direction of the hair growth. Okay. Pull that off. Okay, making sure that the catheter is stable and holding on to that. Okay, there we go. Okay, so I'm gonna grab my 2x2 gauze. I'm gonna put some pressure just above my site, making sure to pull slowly. Okay, I'm gonna pull your catheter out. Okay, and then I would discard that, and I would put pressure for about 2 to 3 minutes. If the site is still bleeding afterwards, I would well, I'm still going to tape this down, but I would hold the patient's hand above their heart until it has stopped bleeding. Good piece, okay. And I'm going to tightly apply this gauze to my patient's hand. Okay. And so then I will discard all of my supplies and items. And I'm gonna, are you in any pain or anything? Are you doing okay?
Yep, it feels good.
Okay, so then I will discard all those, perform hand hygiene, and then I will document, I'm gonna document my patient's response. The catheter was intact. I will document the input and output and the reaction to the procedure, and the input and output record, so the amount of saline that went in through for the patient. Okay, and then is there anything else that I can do for you today?
Nope, I'm good.
Okay, so I'm going to lower the bed to a comfortable position, and I give you your nurse's call, and I will go ahead and move those for you. Okay, and you have a great day.